In this video, I'm going to help you diagnose and treat your anterior or front of the ankle pain or impingement. Let's do it. Hey everyone, welcome to the channel. Ed Dubu, physical therapist, out of Integrated Physical Therapy in Bellingham, Washington. I see a lot of athletes that come in through here, and a common complaint of pain, unfortunately, with my athletes is pain along the front or front lateral part of the ankle, especially with impact or landing activities. When the ankle goes up into dorsiflexion, oftentimes they get pain in that front part of the capsule. When I evaluate ankle pain, especially anterior ankle pain, there's two main culprits that I see a lot. The first one that I see is a talus that's jammed and restricted. And the second thing I see is a tibia, which is this lower leg right here, doesn't internally rotate like it's supposed to. The first thing we have to understand is exactly what's happening when the ankle goes into dorsiflexion. So if you look here, there's a nice little tunnel. And ideally that tunnel is nice and smooth and there's no bone spurs or anything like that. But oftentimes, especially with age, you get little spurs or sharp edges through there. And that can also be a source of pain, especially with impact. When you go into dorsiflexion, this talus here should glide underneath that mortise. From the side, you can see where this talus right here glides underneath that mortise. And oftentimes that talus will get jammed. How do you know if your talus is jammed and if it's part of the problem? A simple test I use in the clinic, I'll have my clients put their foot up on the table here, and I'll show you from the side so you can see what it looks like. But ideally what you want to try to do is to have your knee lining up over your foot, and I'll have them put their forearm right here, and I'll have them drive that knee forward, keeping their heel down. And what I'm interested in seeing is a couple different things. As they get to the end range of motion, keeping their heel down, their ankles into dorsiflexion, I want to see what they feel at the end range of motion. So as you do this test and as you come forward, first try it on your unaffected side. And oftentimes what a normal end range should be, you should come to the end and maybe get a little bit of a stretch through the Achilles, maybe a little bit through the soleus, but you should not get pain up front. So from the side, make sure everything is lined up and you just drive that knee forward. And then what you're after is, if you feel any type of pinching sensation or a little bit of pain up front, then that's positive for an anterior ankle impingement, possibly some talus issues going on, and it means that that talus isn't gliding underneath that mortise. Now, if you are currently seeing a physical therapist, have them evaluate your talus, because the talus may need to be mobilized. How do you mobilize the talus yourself? I'll put a video right up through here. It involves putting a band and then coming forward, and the idea is that we're trying to get that talus to rotate posteriorly as we go forward. So how can we self-correct that tibial rotation at home? Remember, the tibia is kind of stuck a little bit in external rotation. So you have a talus that's not working, and then you have a tibia that's stuck in external rotation. So what you'll do once again is you're going to come forward and get an idea of how it feels. Maybe you get a little pain, a little bit of pinching, then you're going to back off, and then you're going to use the spine of your tibia right here. You're going to use your hands, and you're going to rotate the tibia in. Now you're not just squeezing the calf muscle, you're actually trying to turn the bone in. Now, I don't want your hip to move, so once again, stay lined up. Turn the tibia in, and as it's turned in, then start to come forward over your ankle. If you find that you can go a little bit further, then that means that part of your issue is tightness of that tibia, and it's not going into internal rotation. If you find that when you rotate the tibia in, that it does feel a little bit better to go into dorsiflexion, then what you'll do is you'll keep it cranked and you'll do about a set of 10 repetitions. Turning it to the inside, and I'm coming forward as far as I can for 10 repetitions. After I finish my 10, I'm gonna leave my hands off and come forward to see if I've made a little bit of a correction into that area. Oftentimes it'll start to move a little bit better, and then I would go back and forth between doing 10 reps and 10 reps until I feel like motion has been restored and improved and my end range is no longer painful. Oftentimes you'll get this anterior ankle impingement after a inversion sprain of the ankle. Remember, most ankle sprains are inversion sprains where the bottom of the foot kind of turns in or you roll to the outside of the foot. So if you've had an inversion sprain and then maybe a little while later you're starting to get more anterior ankle pain, then oftentimes they're closely linked. We talked about two of the main causes and how you can go about treating it yourself. The talus is jammed and it's not gliding in that ankle mortise like it should. I talked about a video you can watch where you can mobilize your own talus. The second thing we talked about is having a tibia that's kind of stuck in external rotation. I showed you how to put your foot up on a bench, rotate the tibia in, and then work into dorsiflexion to see if you can't improve the range of motion through that area. After you've restored hopefully better biomechanics, and that the ankle is moving a little bit better into dorsiflexion, then we need to work on just doing some simple entry-level strengthening exercises and also to try to improve the motor control. These are basic ankle strengthening exercises in all 4 planes of motion. If you've been to therapy before, you've seen it. If not, I will quickly go over it. You're gonna need some TheraBand, make a little loop, put it over the top part of your foot. This example, I'm gonna work my right one here. I'm gonna hold some tension and I'm gonna push down and back up. The key is that you want to make sure that your heel is free, so you can put a little towel underneath if you need to. Now I want the tension to come from this side, so I'm just going to use my other foot to kind of block it. Then I'm going to slowly rotate my foot to the outside. Now the tension needs to come from the outside. If you have someone you can hold, if not, you can just lean forward here, hold the band, and slowly work it into inversion. For the last one, you can just loop it around something or have somebody hold it, put some tension on there, and then slowly work your way up. And like I said, if you need to, have a towel or something underneath your heel so that your heel is free to move. Icing and elevating your ankle if there's swelling is also a great idea. In the early stages of rehab, because there's not a whole lot we can do, try lower impact exercises like bicycling, swimming if you can. And the TheraBand exercises I would do twice a day, and I try to keep my repetitions up fairly high. So I would do 3 sets or 3 circles of it all the way around, probably 15 to 20 repetitions, because you just want to use those muscles as a pump, get some fluid out of there, and then restore the range of motion to that joint. All right, guys, if you have any questions about your talus or your tibia or strengthening or anterior ankle impingement, leave it down below. If you haven't subscribed, please do so you don't miss another one of the videos, and good luck.